Hello class, my name is Leani Ruiz. I am a project manager for a large hospital organization in Miami, Florida called Baptist Health South Florida. This symposium is for West Texas A&M University's course in Communications for Healthcare Managers taught by Dr. Ramos Salazar. The name of the article that I am presenting today is called Cultural Communicative Competence in the Caring Relationship with Patients from Another Culture. It's written by Dr. Jessica Ann Viveca Hemberg and Susan Vilander, who has a master's in nursing. This empirical case study was based in Finland and can be found in the Scandinavian Journal of Caring Sciences. To put this into perspective, imagine you were overseas and you happen to fall ill or are injured and in need of medical assistance or attention at a hospital, in a place where you're considered the foreigner. You're brought to a room where the nurse walks in, and after a few short moments, you both realize that neither one of you speak the same language, and you're both from different cultures. So how does that nurse show you that they care for you and your well-being, and is there to assist you in your recovery while respecting your culture and beliefs? Hemberg and Vilander's study's purpose was about how important it is to deepen the understanding of communication with a patient from another culture, and by finding ways to strengthen that intercultural caring relationship according to the nurses' and patients' own interpretations. The main reason why this study was conducted is because the growing population with individuals from different cultures increases the demand of nurses. They hope to discover new methods of caring communication among different cultures along the way. Some notes to consider while reading this article are that culture is variable between generations and other cultures. Patients often follow their own traditions, and nurses should respect that. Nurses can be more culturally sensitive and aware and still provide intercultural caring to those who do not share the same cultural background as them. Lack of cultural knowledge may lead to cultural deficiencies, insufficient treatment, or communication difficulties. A nurse who is knowledgeable of intercultural care and communication feels less stress, which in turn may lead to a better quality of care. Knowing how to bridge cultural differences can lead to less stress, which can turn into a higher quality of care. They used a hermeneutical approach, which means they emphasized the subjective interpretations in the meetings of the written text and constructive thinking. The patients and nurses were asked to answer separate questionnaires. The nurses were asked how they may provide comfort for patients from another culture who do not speak the same language and what methods they use. The patients were asked how they would want a nurse to communicate with them if they do not speak the same language. The study conducted was comprised of only 10 participants, 8 nurses and 2 patients. Results gathered were categorized into 5 main categories with several subcategories within. The first main category was that of human love, which touches on compassion as learned in Chapter 3 in Gwen van Servellen's textbook, Communication Skills for the Healthcare Professional. The subcategories are engagement, faith and hope, kindness, impartiality and compassion, and calm, caring culture. These are basic expectations of those who are there to take care of patients. Nurses are supposed to listen and treat the patient kindly and in a unique way, a human way. The next main category is that of integrity. It was the second category, which was covered in Chapter 6 with trust. The mutual affirmation of each other's cultures and the respect of their differences is preferred and required by the nurse. However, it is important to note that it does not need to be reciprocated by the patient, but there is respect for both sides. The third result is affirming presence in shared suffering and empathy, as discussed in Van Servellen's Chapter 5. Affirming one's presence may be shown in the simplest ways, like the nurse just sitting there holding the patient's hand. The pain the patient is suffering is now a shared experience, and they no longer have to suffer alone. Just by being there, the nurse instills a sense of safety to the patient. Creating a calm environment can create a mirror effect in the patient as well. The feeling of trust alleviates the patient's concerns and creates a warm environment where the patient's spirit is at ease. The fourth result was creative courage, which touched on the cultural competence in chapter number 4 in the textbook. Nurses can communicate through facial expressions, body language, and gestures, as well as through pictures. However, they also need to be able to read the patient's cues as well. Showing the patient an art or a drawing brings the patient in on their treatment. It makes them feel important and included in making those types of decisions. The final category is continuous information. It reminded me of the patient adherence section in chapter 1 of our textbook. This is where the nurse includes either a family member or an interpreter to discuss the care and the treatment of the patient. The problem encountered when including an interpreter is that there is a distance created because it is a stranger who is now involved. Another setback to this is that they may not feel comfortable in discussing personal medical information in front of a stranger. The study found that when family members are included, the nurse gets more information regarding the patient. Also, the family member knows the treatment pathway and can assist the patient, which is helpful because many times patients forget what they're told in the hospital. So having the extra set of ears and memory is quite helpful. My critique of this article is that the results were received by written questionnaire. Had they done an in-person interview, the researcher may have been able to get better engagement from the patient and better results. So perhaps the patient would have been better concentrated or had an immediate reaction where the researcher could have gauged their body language, their tone, the expression, but that wasn't the case. Also, the next issue I had is that there was only 2 patients and 8 nurses involved in the study. There should be more. And finally, the article does not provide any direction as to how the results received will be used to improve the opportunity discovered. So in conclusion, cultural competence is pivotal for healthcare providers in effectively communicating care and human love to patients. Caregivers showing their patients that they respect and humanly care for them may be the key to improving patient outcomes. It is imperative that nurses develop good communication and demonstrate human love with patients who do not share the same culture. And cultural competence is pivotal for healthcare providers in effectively communicating care and human love to patients. However, further research is needed to be able to draw substantial findings and profound results in this essential healthcare discussion. So my questions to you are as follows. From a researcher's perspective, if you conducted this study, what other types of methods or approach would you use to capture results? And how would you go about it? From the health manager's perspective, how could the hospital organization use this data to improve communication of care? What method would you use to incorporate this within the organization, and how would you implement it? From the nurse's perspective, how would you attempt to communicate human love and care to a patient who does not speak your same language? And how do you know you've succeeded? From the patient's perspective, what would you consider to be the most important way your nurse can show you that they truly care even though you don't share the same culture? Please explain any experiences that you would like to share on the subject. Thank you so much for taking the time to viewing my symposium. I look forward to reading your comments in the discussion board.